You'll want to decide whether a child is truly ready to begin the toilet training process. Watch for signs of readiness. Take note if the child wants to imitate others in the bathroom and wants to please parents. This information may come from the parents. Being around older children and other toilet training children can help a great deal. Toddlers are great imitators and they want to see and do what others do. Lots of praise and smiles from you will get a positive response. Be sure that the child understands and can follow simple directions. If the child can't follow directions, they won't be independent enough to manage toileting. There are a lot of steps involved in using the bathroom. Take note for when the child stays drier for longer and longer periods, stays dry for up to 2 hours at a time, and has regular bowel movements. Does the child show an awareness of urination and bowel movements? Does the child show a definitive preference to being clean and dry? This is where those early days of regularly changing a child comes into play. The child must be able to feel the difference. Does the child work to pull pants up and down? Coordination is important. The child needs to be coordinated enough to be able to get to the bathroom, pull their pants down and up, and get on and off the toilet. This requires development on the child's part. All of these notes require that we work to follow the child's lead when it comes to toilet training readiness. Is the child interested in the toileting process? Does he follow his parents into the bathroom? Does he want to flush the toilet? Allow the child to get used to the equipment by flushing or by sitting on the stool if he wants to try it out. Discuss with the family members what terms to use when talking about urination and defecation. Talk with the child about peeing or pooping or whatever terms you decide on. You want to avoid using words like dirty or icky to describe this natural function. Keep it simple. When changing a diaper, say, "You pooped, let's get you cleaned up. It feels good to be all clean." When a child learns about these sensations, there are 3 steps involved. 1. He first recognizes that he is wet or soiled. 2. Later he will learn to recognize when he is wetting. And then 3. He will learn to understand when he is about to wet. Once you have determined that your child is ready and that you have done some of the things that we talked about, make a concentrated effort for 3 to 4 weeks. If toilet training is consistently unsuccessful, stop and let a few months pass before trying again. Delaying toilet training is not a signal of failure, but a signal that the child needs a little more time to develop the necessary muscle control. Wait for a time when there aren't other things going on. It may not be a good idea to start when there is a new baby in the home, or visiting grandparents, or other non-typical events in the child's life. Dress in pants that are easy to pull up and down. This allows for earlier independence on the child's part. Experts disagree about toilet training diapers currently on the market, such as pull-ups. Some say they are just a bigger sized diaper and argue that a child needs to feel wet in order to prefer using the toilet. Others say it can help make a smoother transition from diapers to independent toilet use. Whichever decision is made, be sure that it is consistent or systematic. Take the child to use the toilet regularly in response to each child's biological needs. Children respond well to routines. But remember, children are individuals and should not be expected to perform on demand according to your timetable. Toileting is a biological need, not a scheduled need. Don't overdo it. If there are no results within 5 minutes, praise their effort and comment that next time the pee will come out. After several successes, consider the switch to training pants. Help your child to stop playing long enough to use the bathroom. Avoid sudden stops when they are playing. Give them a warning. Stay with your child and read, sing, etc. to make the bathroom time a positive experience. Does your child have accidents? Remember, it is a complicated process with many steps. He has to first realize that he needs to go. Second, stop what he is doing. Third, make his way to the bathroom. Next, manage his clothing. Then climb onto the toilet, etc., etc., etc. And the child needs to do this consistently. Even if your child is using the toilet a number of times per day, accidents are common and should be treated matter-of-factly. Don't make a big deal out of it. After an accident, encourage the child to use the toilet to finish emptying his bladder. Support the child. Let him know that accidents happen. Next time we'll have to stop playing earlier to get to the bathroom on time. Sometimes a child may be trained for a number of months and then have a series of accidents. If these accidents take place for more than a week, try to determine if there is a medical reason for the setback or if the child is worried about something. Get appropriate medical care if he needs it. Offer your worried child support and spend extra time with him. Often children may be resistant to using the toilet. Resistance is age appropriate. Remember, usually this is the no stage for young ones. Many children resist adult requests during their toddler and early preschool years. If your child is still in this stage, you may want to delay your plans to begin training until he is less resistant to directions and more interested in learning to do this grown-up thing by himself. A child who resists now may be ready in 3 to 6 months, almost overnight. Emotional readiness is important. Learning is a full-time job for most toddlers, and learning to use the toilet may not be as important as learning to climb, run, jump, and talk. With a resistant child, it may help to say, "Let's go to the bathroom," rather than asking if he has to go. He is likely to answer no. Give him the choice to use the potty chair or the big toilet. Simplify your directions so that you are sure he understands. Be sensitive to a child's fears. A child may resist using the toilet because he is afraid of the flushing noise. If so, wait until the child has left the room before flushing. A child may fear falling in. Use a potty chair, a toilet seat adapter, or step stool to help him feel more secure. If your child is afraid that something will bite his bottom, you may have to convincingly call the culprit out of the toilet and order it out of your bathroom never to return again. What about giving rewards? Some people prefer not to offer an incentive for a behavior that is so natural. Others find it very helpful in getting the toilet training started. If you do use an incentive program, be sure to use gentle praise along with any trinket. Remember that the greatest incentive should be staying clean and dry. Incentive ideas can include stickers, a star on a calendar, pennies in a piggy bank, barrettes, bracelets, small cars. But be clear that when your supply is gone, he won't need any more because by then he'll know how to use the toilet. When the goodies are gone, be ready to involve him in another activity as soon as he is done, so he won't notice the lack of a trinket as much. Stop here and answer the question about rewards and incentives.